Are you suffering from knee arthritis? Are you dealing with knee stiffness in the morning when you get up? Do you have swelling that comes on from time to time? Maybe your knee is hot and inflamed right now. Have you found that lately you've needed to sit down and rest your knee more and you can't walk as much as you'd like to? Have you had an x-ray and a doctor told you that you have bone-on-bone knee osteoarthritis? Well, if this is you, then you need to learn more about our Knee Arthritis Recovery Program and consider joining it. This program is designed to help you naturally heal knee arthritis so that you can get back to being healthy, active, and mobile. Specifically, this is going to help you end taking medications, pain medications, and relying them day to day just to get through the day. It's also going to help you stop visiting the doctor for knee injections, those pain injections that people get in their knees. You don't need to go back to the doctor every few months to get these. And most importantly, it's going to allow you to postpone and likely even cancel that knee joint replacement that you might have already signed up for. My name is Dr. David Midoff, and I'm a specialist manual physical therapist, and I've been helping people heal all over the world from knee arthritis. Now, specifically knee osteoarthritis. What I don't help people out with is psoriatic arthritis or rheumatoid arthritis or any other kind of arthritis. I'm talking about knee osteoarthritis, which is the most common knee arthritis that people get. It's the one that you can see on the x-ray, the one that tends to come on when you're in your 50s, 60s, or later, the kind that people are getting knee joint replacements for all the time. The reason that my treatment approach is so successful at helping people recover from knee arthritis is because it addresses the root of the problem. In reality, most healthcare professionals out there are not treating the root of the problem when it comes to knee osteoarthritis. They are thinking about treating the symptoms. They're focused on giving you pain medication to give you temporary relief from the pain that comes with knee arthritis. They're also focused on giving you injections, which is pain medication injected into the knee joint. There's other kinds of injections like hyaluronic acid injections, stem cells, PRP. All of those treatments are not intended to give you long-lasting relief because you have to keep doing them over and over again. They're not true long-term fixes. And even surgery, surgeons are not giving you a long-term fix. They're cutting out the joint and replacing it with new parts, but they're still missing the root problem.
What it comes down to is what I've discovered is it's the imbalance of the muscles, like Dr. D always says. I didn't know that. I wasn't raised that way. I didn't know anything about it, but the way he explains it, I go like, oh my God, the light bulbs are just getting on all the time. I go like, that's it. How can you expect a skeleton to uphold itself if you don't have muscles?
Let me explain what the root problem is to you. I've got my knee joint model here, and the way that this works is there's muscle imbalances. People have muscle imbalances, those that have knee arthritis. If you look at the knee joint here, there's a kneecap right there, the thigh bone, and the shin bone. When you have a muscle imbalance that compresses the knee joint and wears down the cartilage, it's usually the muscles on the front of the thigh, the quadricep muscles, that are way too overdominant. The hamstring muscles are often dominant too. When those muscles are too dominant and too strong relative to other muscles that are very weak and not dominant, then you get excessive compression in the joint. Usually it's the glute muscles, the butt muscles up in the back of the hip that need to get stronger in order to allow those thigh muscles to calm down and allow normal pressures in the joint, the kinds of pressures that aren't going to make your cartilage wear down and progress arthritis. This is fixable in most people, but they aren't guided to do it. I mean, when was the last time that you were doing focused glute exercises and at the recommendation of a healthcare professional?
I started watching the YouTube videos for El Paso Manual Physical Therapy, and I was learning enough just from those that I decided I would take the knee pain program, and I think it has helped me. I'm not perfect, but I'm not getting a knee replacement, and that's my key goal in doing what I've been suggested I do. Most important is learning to use my glutes when I am either bicycling or walking up or down stairs or swimming, and no one had ever told me that in all the various doctors I've seen over the years, or PTs. So I have focused on that in the last 18 months, and I think it has made a big difference.
all I can say is, trust me, I've been around the block a couple of times, and I have had some bodily issues over the years, the decades behind me. All I can say that what this man, Dr. D, David Middow, what he teaches, what he helps you with is stuff of your dreams. Absolutely, because it basically comes down to you doing it, but the way he explains everything, that it makes sense in a simple language. I'm a simple language girl. And then do the exercises, which are simple. And in his programs, I love his programs because he builds it up. He literally says, don't go to module 3 unless you can do module 2 totally without any pain. That's what I like, the guidance.
And speaking of exercises, you may have been referred to a physical therapist because sometimes surgeons, in an attempt to allow you to heal naturally and put off a surgery, will send you to physical therapy. But most physical therapists out there are also on the wrong path. They're not treating the root of the problem. They're focused on treating people who have just had a surgery. If you go to any PT clinic, you look around, talk to the people there, probably 2/3 or more of them have had a surgery in the past month or two, and they're in treatment right now to recover from that surgery. And by default, because those physical therapists tend to see people who have just had surgery, they're best at helping people recover from surgery. And if you're trying to avoid a knee replacement surgery, you're trying to manage your knee arthritis, then you're likely going to get treatment from somebody who doesn't specialize in that. That's what I specialize in. I help people avoid a knee joint replacement and get back to being healthy, active, and mobile. So if you're going to see a physical therapist, they're likely going to have you do quad exercises and cycling and walking, which is one of the first things I tell people to stop doing. Walking and cycling are actually one of the worst things you could be doing because there's some other things you have to do first in order to successfully get to the walking and biking. Most people don't realize this, but those activities, many of these exercises that physical therapists are giving knee arthritis patients who are looking to avoid surgery, they're actually aggravating their problem over time. This usually leads to the physical therapy ending with the therapist saying something like, hey, this didn't work out for you, let's send you back to your surgeon. The surgeon's happy to receive you back and say, let's go ahead and proceed with a knee joint replacement. So this is why surgeons are missing the mark when it comes to fixing the root problem of knee arthritis, and a joint replacement isn't the solution, because if you go into a joint replacement surgery, chances are you still have that imbalance. And in fact, it's probably worse after the surgery because you get weaker. You have to go through a rehabilitation process afterwards, and your muscles are just much weaker than you were before the surgery, so you're starting from a lower level. This sets you up to actually have more problems afterwards. Now, the surgeon might say, hey, my surgery is just fine. They'll do an x-ray if you still have pain afterwards, which tends to happen. They'll say, all the parts are in place, there's nothing wrong with my surgery, but often what we find is people still have pain. Maybe around the knee, sometimes above the knee, up in the hip joint, sometimes down the leg, even into the foot, and it's still because of that root muscle imbalance that set up the knee arthritis in the first place. So whenever I have my patients that come in and say, I'm really leaning towards getting a knee joint replacement, I tell them, fine, go get it. You might be a great candidate for it. I might not actually be able to help you, but don't ignore the root muscle imbalance, because then you're still going to have problems later on after you get a knee joint replacement, and you're not going to be content with the outcome of your surgery. And surgeons know this. They see patients all the time. They're not happy with their joint replacement surgery. There's some that are, absolutely. There are many that are not. And I would hate for you to be one of those. I want you to even just avoid the surgery altogether, fix the root muscle imbalance, and get back to being healthy, active, mobile, doing all the things that you love to do. So my program is called the Knee Arthritis Recovery Program. And what's included in this program is you get access to the core videos of the program. It's over 40 videos of me walking you through all the components of my treatment approach. It's as if you were in treatment with me here, and I'm exhaustively telling you everything that you need to be doing. It's divided up into phases, and you can't move on into the next phase until you hit certain milestones so that you can safely move into the next phase without doing anything that's going to make your knee arthritis worse. Now, in addition to those core videos, that program alone is of high value, and you can just fix your knee arthritis problem with just that. But we're also going to be giving you weekly group coaching calls. This is going to be with me and my team. Every week will be available for you to ask questions. We'll also do a little bit of teaching, and you'll have access to the recordings of past group coaching calls so that you might learn from those. We're also going to have a private community where you can meet other people that are in the same journey as you, trying to avoid getting a knee joint replacement. So here's what I want you to do. Go into this webpage and explore the options that work best for you. And I want to see you inside the Knee Arthritis Recovery Program so that we can get you out of surgery and get you back to enjoying life to the fullest. I'll see you inside the program.